In today's video, I will be critiquing the issue of weight gain during the uptake of antipsychotic medications in schizophrenic and first episode psychosis patients. Throughout this video, I will be referring to antipsychosis medications as APs and first episode psychosis as FAPs. So my area of uncertainty surrounds the reason for weight gain in those taking APs and what methods or interventions or pharmaceuticals can be developed to reduce this weight gain issue. Some questions I have are: what are the long-term impacts of APs on an individual's physical and mental health? How does weight gain affect the individual physically and mentally? What can be done to ease the use of APs for the individual? Why does rapid weight gain occur, and why is it so difficult to lose this weight after medication has been stopped? And is it possible to develop an antipsychotic that doesn't have longer-term implications? After some thorough research for an article that addressed my questions, I found a systematic review conducted by the Yale University Department of Psychiatry that were interested in decreasing the risk of cardiovascular disease in FAP patients taking APs, and looked at studies to monitor short-term, so less than 12 weeks, and long-term, more than 12 weeks, weight gain and BMI change in this cohort. So using the JBI analysis checklist, I went through and answered the questions. So the first question was, is the review question clearly and explicitly stated? This one's kind of unclear. So although the aim of the study is clearly and explicitly stated numerous times, there's no clear outline of a question, rather a number of points that the authors are trying to address throughout their study. Then the analysis's aim is to conduct a meta-analysis of antipsychotic-induced weight gain and BMI change in the first episode psychosis to prevent cardiovascular and metabolic mobility later in life. They claim that the FAP period presents a critical stage to prevent these outcomes in those who take APs for either a short or a long term. Next question is, were the conclusion criteria appropriate for the review question? Yes, it could be said that the inclusion criteria were appropriate for the review question. The inclusion criteria for the study were as follows. There's 4 of them. First is studies in first episode psychosis patients, AP naive or with prior AP treatment for less than 16 weeks during their lifetime. Studies that were conducted in patients with a minimum age of 15 years to reduce the confounding effect of continuing growth and weight on BMI. Studies that were conducted in outpatient settings to limit restricted diet effects in inpatient settings, and studies that reported available weight and or BMI data during the intervention phase. These criteria just allow for our study to be adequately answered without the presence of unnecessary or irrelevant information. Third question was the search strategy appropriate? So yes, there was a clear PICO strategy that had been applied to this analysis. Search terms included antipsychotics, medication naive, first episode psychosis, schizophrenia, and weight. The authors initially generated over 3,000 articles, and they had a total count of 2,594 male participants, 1,545 female participants, so a total of 4,139. 5 studies were double-blinded, 1 was single-blinded, and 22 were open-label. In their first cull, the authors excluded 208 non-English studies, 108 non-human studies, 216 case reports, 113 interventional studies, 375 cross-sectional studies. They also excluded 1,051 comments and reviews, 77 studies that had a sample size age less than 16, 151 studies that focused on other disorders. Excluding these items just means a more refined and relevant search, utilizing only randomized control trials, which we know are at the top of the hierarchy. Excluding non-English studies just means that other populations wouldn't be included. The authors were comparing Asian and Western samples, so excluding non-English studies would have altered some of the results. They found that weight gain was higher in Western samples than Asian samples, so more research is needed in that area. In the second cull, they cut 732 studies that did not meet the requirements of meta-analysis through a lack of vital information that were also excluded from the final investigation. The fourth question was, were the sources and resources used to search for strategies adequate? So yes, the sources and resources used to search for the studies could be considered appropriate. The researchers outlined their approach in the methods section of their paper. They searched 3 databases, PubMed, PsycInfo, and Web of Science from 1950 to 2014 in August. However, this time frame would have brought about studies that utilized first-generation antipsychotics, in which weight gain was not a prevalent side effect as it is in second-generation APs. This could have possibly had an influence on the results. It would mean that research in second-generation APs and their long-term psychological and physiological impacts would have been fairly scarce, as they only became popular in the last 2 decades. It's also important to note that the researchers utilized a database that's specific to their area of study, allowing for more relevant searches to be yielded. Additionally, the authors created searches from references and retrieved articles, related review articles, and meta-analysis to broaden their spectrum of results. The next question was, were the criteria for appraising studies appropriate? So yes, the authors state the meta-analysis was conducted according to the preferred reporting items for systematic reviews and meta-analysis, or PRISMA guidelines. Although this tool hasn't been scientifically validated, it's the most accepted tool to minimize bias and ensure all aspects of the systematic review were covered. 6. Was a critical appraisal conducted by 2 or more reviewers independently? Yes, it was. So it was conducted by 2 independent researchers, SJ and SK, and the third reviewer, CT, was used in case of any conflicts arising. Multiple reviews just minimizes the risk of bias and systematic error. 7. Were there methods to minimize errors in data extraction? So yes, using 2 reviewers and a third minimizes error in data extraction. 8. Were the methods used to combine the studies appropriate? So yes, studies were categorized and combined based on study design, medication dose, funding source, study region, weight, and BMI outcomes. Outcomes of overlapping samples from the same investigators were then extracted. Additionally, the authors used correlation coefficients to calculate and input the missing standard deviation of change from baseline samples. Heterogeneity was assessed throughout the meta-analysis procedure using Q and I-squared statistics. 9. Was the likelihood of publication bias assessed? So yes, the authors aim to avoid publication bias by a few methods, conducting research on both published and unpublished studies, using funnel plots for visual assessment and Egger's regression test providing a statistical evaluation. Other biases such as relationship between weight and location and sponsorship bias, so government and independent studies versus pharmaceuticals, were subject to a meta-regression analysis. These are validated means of assessing publication bias. 10 were recommendations for policy and or practice supported by the reported data. So this one's not applicable. The authors didn't make any recommendations for practice, as much more research is needed into the use of antipsychotics, although they did ask that clinicians be mindful of the impacts that APs have on their patients. 11. Were the specific directives for new research appropriate? So yes, the study at hand outlines numerous limitations that could be addressed with further research. For example, they highlight the lack of Asian studies, and the most report lower weight gain while using APs as opposed to Western countries. Next, there are inconsistencies with how weight gain is monitored across studies. They recommend a standardized manner to ensure more accurate results for meta-analysis in the future. Additionally, they suggest more long-term studies in the effects of cyprosidone and apropoprazole in FAP, as these drugs report little weight and BMI change in short-term patients. It could be said that these directives are appropriate as they address limitations within the current study. So next, just considering the outcomes of the article. In summary, the author's research found that weight gain in FAP and schizophrenic patients was associated with duration AP use. In addition, weight gain was high in Western samples over Asian samples. They found that ziprosidone displayed similar results to the placebo in the short term, and that aripiprazole was associated with short-term weight gain when it was previously thought to be a neutral AP. The main issue with this study is that it is unethical to undertake a randomized control trial in FAP patients using a placebo. So thus, the main ways that these studies are conducted is through comparison of an antipsychotic that's already on the market. Only one study in their meta-analysis had used the placebo in an ethical manner. Also, much more research is needed for the long-term use of antipsychotics. While this study tackled a number of hurdles by summarizing which medications increase short-term weight gain and identified a critical period to eliminate the risk of CVD morbidity later in life, those who use APs for an extended period of time, which is the reality for most people living with schizophrenia, the long-term effects are twofold. This research is beneficial to answer some of my concerns and uncertainty. The authors highlight how short-term effects impact the individual in the long term, i.e. weight gain-induced APs can lead to CVD later in life. They also emphasize that early and continuing effects of APs should be taken into consideration by clinicians. Although we're still a while away from developing drugs that do not display these implications, the research was a great step into starting the conversation in the long-term impacts. In conclusion, much more research is needed into antipsychotics, how they work, the physiological, emotional, and mental effects they have on an individual. Although second-generation antipsychotics are beneficial to first-episode psychosis patients, first-generation antipsychotics cause extrapyramidal effects and are less favored. While second generations have less extrapyramidal effects, they cause cardiometabolic effects such as weight gain. This could be translated into a clinical environment by ensuring clinicians are aware of the implications of APs and introducing measures to counteract these effects. This may include exercise, a good balanced diet, and strong social connections.